So I'm watching ER today because now, since I don't work there as much, I need to watch ER more so I get my ER fix. I'm at the end of like season 3, and charge nurse Carol Hathaway has just quit. Just looked Dr. Green in the eye and went, you know what? I quit. And here's the thing, I'm freaking here for it. Because let me explain why she quit. Carol quit because she saw the worst about the U.S. medical system over and over again on this one particular day. It started with a newborn patient coming in with respiratory issues because they had an undiagnosed cardiac defect. Fun fact, it's hypoplastic left heart syndrome, which is the same thing I have. But this baby was less than 12 hours old when it was discharged from the hospital, and it was discharged for insurance reasons. Then they had a patient who was about 46, I think, year old male with lung cancer who chose not to seek treatment because it was going to be too expensive. And then they had a pediatric patient with a severely broken ankle that would require surgical intervention. And her insurance company demanded that she get shipped across the city, which this is in Chicago, so across the city to a hospital they cover for her to have surgery. Now your question may be, Ellen, what are you talking about here? Why are you talking about this? It is because in the 90s, this was an issue and it still is today. No one should be profiting off of people's lives. Nobody should be profiting off of people being sick. It's not okay. Because here's the thing, and this is a common thing that you hear with it when it comes to health insurance types of thing, is a patient cured is a customer lost. And I'm here to say, screw that. Because here's the thing, people will always get sick. People will always get hurt. You don't have to keep people sick because people will continue to get sick. I truly believe there is, in fact, a cure for the common cold. However, it makes more money to give people Tylenol and Motrin and, alleviating things and just letting their body do it instead of making it go away. And the other thing is you hear all these anecdotal stories from people from the U.S. who go abroad and something happens. They break a leg, they get a tummy bug, or whatever it is. And they go and get care there, and the hospital's like, I am so sorry. Unfortunately, you don't have insurance, so you will have to pay for this medical bill. And then they're like, it's $200. And you're like, that's my copay for the ER. What? That's my whole bet? That's the whole thing I have to pay? Yeah, we're so sorry. It's so pricey. And I'm like, that is not pricey. Healthcare is a basic human right. Every single person in the world, I don't care who you are, I don't care what you've done in the past, you have a right to medical care. You have a right to be healthy without worry about if you can pay for it. And every once in a while, this really hits me. Every once in a while, it just strikes me so hard and so close to home. Whether it's me taking care of a patient and that patient making the decision that they would rather go home because they know Medicare won't pay for an observation stay, despite the fact that I know that observation stay very well may, come with results that change, the course of action, change the plan of care, can change a person's life from that observation stay. That observation stay is so important, but people say, well, I can't afford that. Or I know certain testing really needs to be done on a patient based on their complaint, and then they tell me, I don't want all that, I just want this one test because I can't afford a whole hospital bill. And it hits closer to home when it's me. When I get my bill in the mail, true story just happened, for $300 for blood work that I needed done. Now, luckily, I am privileged enough to be financially stable. So as much as paying that $300 hurts my soul, it is not the difference between eating and not eating. So I am absolutely privileged in that, but I know people are not. I know I made the video about my one cardiac med that's $43 with my insurance. I know that $43 is steep for a lot of people. And this goes even further with employers demanding doctor's notes for people who are sick. Because now not only is this person probably not making money that day because they are unwell, but now you're making them go spend money at a doctor's office and waste their time and their day. They should be at home resting. This whole system, let's be real here, this whole system is just capitalism. The part where you have to explain why you're not at work, so you're not getting your money, and then you have to explain why you're not getting your money by going to spend money either at your doctor's office, an urgent care, or an ER, which often happens, and I understand. It's not what the ER is for, but I understand why people have to use it. So you're sick, so you're not earning your money, you're spending money to go get the proof as to why you didn't come in and earn your money that day. And then, because EMTALA is a thing, you have a right to a medical screening, so you can't really just walk in and go, hey, can you write me a doctor's note? No. You have to be seen by the doctor, and I'm going to tell you right now, 9 times out of 10, the doctor's going to order testing on you, especially in the hospital I work. And it's just this cycle of bullshit. So circling back, Carol Hathaway quit because she was sick and tired of seeing profits over people, profits over patients. And you know what? I'm sick of it too. I am sick of having to try to beg people to stay so I can take care of them in the best way that I can, but also at the same time knowing I understand why you don't want that or can't have that happen. And being the person who is looking at that bill going, dear God, that is so much money for a blood draw. The U.S. healthcare system is bullshit. It needs to stop. We need universal healthcare. Now, are all universal healthcares created equal? No, they're not. However, this whole system needs to be rebuilt so that even if you're at the wrong hospital, you don't have insurance, that type of thing, we are not bankrupting people. We aren't preventing people from getting better because they can't afford to be well. Tear the whole thing down and start over. It's the only solution.